Namaskar, I am Gayatri, your anchor for today's Cardio Kidney Metabolic Connect talk show held in Cardiology Conference in Kolkata. In our initiative to build mass awareness about cardio kidney metabolic diseases, which is impacting every Indian household in current times because of growing incidence of sudden heart attack, kidney problem and diabetes. To throw more light on this, today we have with us Dr. Johann Christopher from Hyderabad. Welcome, sir. Doctor, can you briefly introduce about yourself to the viewers?
I'm Dr. Johann Christopher, Consultant Cardiologist for the last 17 years at the Care Hospitals, Hyderabad. I did my training at the Christian Medical College and then the advanced training at the Harvard Medical School at Boston.
Thank you, Doctor. Welcome to the show. Doctor, my question to you is, how can a person check or his or her heart is healthy?
Yeah, I think it's a very important question because we've had the sudden spate of sudden cardiac deaths. So I'm a firm believer that there is nothing called a sudden cardiac death. A simple reason is that we are not screening our patients, our population early enough. So most of the disease has been accumulating right from the age of 18 and 19. And when you are in 30, there's a whole buildup of cholesterol in your heart. And then any kind of a stressor, it may be lack of sleep, it may be emotional stress, it may be physical, or it could be just bad habits can be a trigger, and that whole mass of cholesterol then ulcerates and you get a heart attack and sometimes even a stroke. So I don't call them sudden cardiac deaths, I call them deaths waiting to happen simply because we've not been taking care and we don't have a big national statewide policy to screen our young individuals who are genetically susceptible just because we're South Asian people of South Asian descent.
Doctor, my next question to you is, what is the symptoms of heart blockage and what is the routine test we have for the blocked artery?
Yeah, very good question, because 50% of our patients when they present, they never had any symptoms in the past, and that's Indian data. That means 50% of patients who come to me in the emergency room with a heart attack have never had symptoms before. So while symptoms are important and they would include a central chest pain, which comes on with exertion and then goes away when you sit down or relax, or a pain which is very non-specific and heaviness when you're moving around, which immediately goes away if you take what is called a sorbitate tablet under the tongue. This is a classical anginal symptom, but most of our patients do not present with this symptom, and most of them are diabetic, and we know that diabetic patients, because of the autonomic neuropathy, do not have the classical chest pain symptoms. So the pain of angina can be anywhere from the jaw to the upper abdomen, and most of our patients have gone to dental specialists, they've gone to gastroenterologists because they feel the pain is not coming from the center. So pain, although important, is not very sensitive, and many of our patients are asymptomatic. So what is very important is screening populations at regular intervals, especially if you have a parent, a mother or father who had heart disease before the age of 50, if you smoke, if you consume excessive alcohol, or if you have a sedentary lifestyle and you have other risk factors like diabetes, hypertension and obesity. The screening involves a basic standard 12-lead ECG, a basic 2D echo and a treadmill test. If you're unable to walk due to any reason, we have a test called a dovitamin stress echo or a myocardial perfusion scan, which is now there in most of the big Indian cities. And if you do all these tests together, generally the chance of missing a important heart blockage is very, very low. The new test which has now come in over the last decade is called the coronary CT, which comprises of looking at blocks in the heart in a non-invasive manner in just 5-second scan. And I would recommend this for anybody who has a significant risk factor profile, who has a very strong family history.
Thank you, Doctor. And now your message to the viewers to keep their heart healthy.
Yeah, we have a very important and strong message to all the young people out there who are contributing heavily to India's GDP journey, and we know that we are due to become a 5 trillion economy in the last 10 years. So it's very important to stay healthy, to continue working and contributing to a great nation. And the way to do it is to screen yourself, especially if you have risk factors, especially if you work in jobs where there's no chance for exercise. Go to the nearest physician, cardiologist. Most of the tests are done very cheaply. We have a lot of online lab tests which look at your cholesterols, which look at your sugars, looks at your thyroid. Very easy to do. They come home, take your samples. So I believe from the age of 20 itself, if you have a high risk family history, you must start doing If you don't have, then at least at the age of 30, we must do it. I also urge all universities who are accepting students for college to do a basic screening of at least cholesterol, blood pressure and sugar, and that will screen a lot of young Indians very early and allow them to take corrective measures before they come with cardiovascular symptoms. Thank you very much.
Thank you, doctor, for your valuable advice on how to keep the viewers' heart healthy and also protect them from cardio, kidney, metabolic diseases and also their loved ones. Thank you, doctor.
Thank you very much.
And stay connected, log on to Cardio, Kidney, Metabolic Connect. Also, follow us on Dil Se Dil Tak Healthy Heart, YouTube, Facebook, Instagram, Twitter. Namaste. Thank you.